Thank you, Dr. Ma. Thank you, Dr. York. And congratulations, Dr. Pryor, on your election. And thank each and every one of you for being here today. I'd also like to thank our sponsors quickly. You should have gotten this packet box in the mail, and our sponsors are listed there inside, so I wanted to show you that. If you didn't get one of these boxes and you're a delegate delivered to your house, please let Kathy Johannesson know, and we'll make sure you get it. And while I'm thanking sponsors and others, I really want to thank each and every one of you for being part of an incredible group of people who are helping us fight the pandemic and truly being healthcare heroes who are serving us every day. We appreciate your membership, participation, and dedication to healthcare. And what I'm going to do for this operation report is really focus on our work around COVID and how we've dealt with operational issues and changes. I have a more detailed operations report that you can read online. But I'm going to start really with the beginning of this crisis, or at least the beginning for us. And that was with Dr. O'Keefe and Dr. Bruno reaching out. Dr. O'Keefe is the chair of our disaster preparedness subcommittee, and Dr. Bruno is the chair of our public health committee. And they together reached out and asked that we send something out immediately, which we did. We sent an alert out actually back in January. I'm not misstating, back in January, saying, you know, this is a problem, COVID's real, and we need to deal with it. And remember, most other people weren't even paying attention until March. So that was huge. We were also the first organization to do a CME on it. And I really want to thank Dr. Manahan, who's been an incredible president and leader during these very complex times. Under her leadership, we've done calls with other Mid-Atlantic states to coordinate our COVID responses and help on resources for physicians. And she developed a CME that we've been giving virtually to keep connections with components. And if you haven't seen the physician identity defining a new Rockwellian portrait, I really suggest you reach out and schedule it for your medical staff or your county medical society. It's a great CME, and we've heard incredibly positive feedback from the physicians and others who've taken it. During the crisis, we really were focused on the physician, the patient, and the public health, our mission. From a patient point of view, the state of Maryland needed help managing testing sites, and we repurposed some employees under a short-term contract to do the scheduling until it became on demand. I appreciate the staff being flexible and being willing to do it, and I think it was important. It also helped us with regards to bringing some revenue in when we were taking major hits to loss to some of our business lines as a result of COVID. When it comes to testing and public health, we worked very closely with the administration and got additional PC point of care POC testing available. And we also asked the state to create an ad hoc testing committee. Several members, including MedChi board member Eric Wargotz, are serving on that testing committee, and we're trying to come up with good policy around COVID testing for the state. Moving forward, vaccines, and the COVID vaccine will be another major public health measure that we're going to have to work with the state on. We do have a representative on the COVID vaccine subcommittee, and we have sent out the draft state vaccine plan to all of the membership for comment. This will be a big deal as we move forward, and we will be taking a leadership role in Maryland on the vaccine issue. During this whole crisis, very early on, we've had a great relationship with the health department, and we've worked very closely with Secretary Neal and Dr. HAFT and others. And in fact, early on, Secretary Neal made a decision to make Dr. HAFT our point person for information, and it's gone terrifically. Dr. HAFT has been doing regular calls and webinars to inform us on updates on COVID. From the beginning of the pandemic to now, we've had over or close to 3,000 independent different physicians take one or more of these CMEs and these webinars. And MedChi has provided CME for them. Early on, we were doing 3 to 5 a week. We're now doing them every Wednesday. I'd like to point out that this Wednesday coming up, we're going to be doing a special CME that we've added on that was not on the schedule on Wednesday, November 11th, with Secretary Neal and Dr. HAFT, kind of giving an update as the numbers are growing. This coordination has been incredibly helpful, and I can't say enough in appreciation of Secretary Neal and Dr. HAFT as we continue to coordinate and get information out through them. And that's really what we've been trying to do, is keep you informed throughout the crisis. We added a special COVID email. Early on, when we had lots of information to send out, we were sending out 3 to 4 a week. We're now sending them out just once a week on Wednesdays, but they have important information that you need to know dealing with the pandemic. This information is not just going to the members of MedChi. We're sending it to every physician we have an email address for. Over 18,000 physicians are getting these on a weekly basis from the society. It became very apparent early on that economics and money was going to be a major concern for physicians, and we've helped physicians in every setting with economic support. We've helped physicians in employed setting, understanding their hedge fund contract or their contract with the hospital or someone else, and we've helped private practices apply for economic relief. We've helped physicians apply for relief in various different programs, ranging from payroll protection to disaster recovery to state programs to county programs. The counties and the medical society working together have done an incredible job, and we've helped hundreds and hundreds of practices apply for programs, and we've also troubleshooted for people who've been denied or had other issues. And we've talked to lots of people who've needed help as we work through this. And I think I just can't say enough in appreciation for everything that Montgomery County, Baltimore County Medical Association, Baltimore City, and Anne Arundel have done to really be available for the physicians and to coordinate with us as we've responded to their needs during the entire crisis. Economic relief is not the only thing physicians have needed. Another thing that we've put a lot of energy and time into is telehealth. And as we've switched and telehealth has become more prevalent, there were a couple things that we've done. First of all, our advocacy team helped create 2 grant opportunities for physicians in Maryland. The first was a Maryland Healthcare Commission grant that we lobbied for, and they created, that provides education assistance and funding for telehealth for new practices that are bringing it on. And then the other is Care First worked with MedChi, and that's not a typo. Care First did work with MedChi and provided us with funding to cover the cost of Dr. First for small practices in Maryland if they enroll by the end of the year. And it covers a year. It's a check that the practice gets. And that's huge. We have probably helped hundreds of practices, maybe even more, implement telehealth during this period. It's been something that's been a top priority. And we're continuing to work on this as we move forward. Our focus has now moved more into remote patient monitoring, which we think is an incredible economic opportunity and a great public health tool. We're working with 3 or 4 different platforms. We'd love to talk to you if this is something you're interested in and help you out with it. We think this is a way that you can bring in additional revenue, but also really help chronic patients. We also are working with Dr. First to prescribe, I prescribe at no cost, which allows you to comply with electronic prescribing mandates. And this is a great tool that you can use if you're moonlighting, or maybe if you haven't gone to an EMR, you're still on paper records, to do e-prescribe and meet those mandates. So we see this telehealth IT space as an important place for us to be helpful to physicians in all kinds of settings. One other thing we did as a result of the pandemic and all these doctors taking on telehealth was we built and create a really good coding guide. This is the first page of it. It's actually about 7 or 8 pages long. It's on the website. If you were to pay a practice manager to do this, it would cost you easily 6 to 7 figures to do so. The fact that you're a member of MedChi and you get this type of resource for free is huge. If you haven't looked at it, if you haven't showed it to your office manager or your billing person, make sure you let them know that we have it and it's available, and it's something else we did. We will be working on telehealth from an advocacy point of view next session, as laws and things will need to be adjusted to the new world that we live in. Advocacy has been a major concern throughout the whole pandemic. We really have focused on executive orders, and one of the things that we've been doing is preventing scope of practice creep. We've worked closely with specialty societies to make sure that various non-physicians don't come in and ask for extensions in the executive orders, and thus far we've been relatively successful. The biggest issue with regards to advocacy clearly has been tort. MedChi worked closely with Governor Hogan. We had numerous calls with Mike Padone, the general counsel, and others to have the governor issue an order protecting us under the Maryland Public Safety Immunity Act. If you want to learn more about this, I have a great video that explains the protections that are provided by that and how these immunity protections work. But we're going to need to continue to work on this issue. We got together a group of Maryland stakeholders ranging from Care First and Kaiser, the Maryland Hospital Association, to say that we need additional immunity protections, and it's going to be a priority as we move into session. While you guys have been working to figure out how to fight this crisis, this pandemic, this disease, and help your patients, there's a whole lot of lawyers who've been sitting around figuring out ways to sue you. And this is a big issue for us, and something that's going to be a priority is figuring out how we protect you from those lawyers. Tort and economic issues are not the only ones we've worked on when it comes to executive orders. We strongly supported Governor Hogan's mask order, and in fact, we requested that the AMA advocate for a national mask order. We helped understand and implement reopening of elective procedures and helped practices like yours fill out the forms necessary so they could reopen when the stay was lifted on elective procedures and non-urgent medical conditions. And in fact, with all of the executive orders, we've made a point of trying to explain and help doctors deal with them. And explaining and helping doctors deal with things is something that our law department has been doing as well. We've answered countless questions ranging from human resource concerns to legal questions, restrictions on practice, what do I do if, Board of Physicians issues. One of them that we've done a lot of work on as well is business interruption and insurance coverage. And if you feel that you had a business interruption claim denied and you want to talk to a lawyer about it, you can call MedChi and we're happy to talk to you about it. But we're here for you to answer the questions that you're having during this pandemic and try to make sure you get the answers you need when you need them. I can't say enough about the staff and how wonderful a job they've done helping keep the place running, and running not just okay, running well, maybe in some cases better than we have before. We've switched to largely remote with the exception of some people who want to come in the office. It's gone amazingly well, and I can't say enough to thank the MedChi staff for what they've done during these unprecedented times. Again, I wanted to keep my report short, and there's a longer, more in-depth report that gives breakdowns on some of the different departments and what they're working on and how they've managed things throughout COVID. And I'm always available to answer any questions. But I can't say enough to say thank you for being a MedChi leader. And I really would like you to go out and tell your fellow physicians how important we are, and where would we be without an organization like MedChi fighting for physician rights, with our partners, with our friends at Annapolis, and maybe at times even against our enemies. MedChi is really important, and I need you to tell your physicians that you see in the lunchroom or at the medical staff meeting or in the hospital hallway how important we are, because we need folks more than ever to be involved and be engaged, because we're entering into trying times for all of us as we try to see how healthcare works in this new world. Thank you so much for allowing me to work for you and with you.